Have you ever wondered why people think, feel, or behave so differently? Psychology says mental disorders can deeply affect emotions, thoughts, behavior, and daily life. And while every person's experience is different, understanding these conditions helps us better understand the human mind, brain, mental disorders, and effects. 1. Anxiety disorders. Generalized anxiety disorder, GAD. Backhand index pointing right, constant excessive worrying, overthinking, tension, mental exhaustion. Panic disorder. Backhand index pointing right, sudden panic attacks, racing heart, fear of losing control. Social anxiety disorder. Backhand index pointing right, fear of judgment, avoiding social situations, intense self-consciousness. Phobias. Backhand index pointing right, extreme fear of specific objects or situations. 2. Mood disorders. Depression. Backhand index pointing right, persistent sadness, low energy, loss of motivation, emotional numbness. Bipolar disorder. Backhand index pointing right, extreme mood swings between emotional highs and deep lows. Persistent depressive disorder. Backhand index pointing right, long-term low mood and emotional heaviness. 3. Trauma disorders. PTSD, flashbacks, hypervigilance, emotional triggers, fear responses. Complex PTSD. Emotional instability, trust issues, difficulty feeling safe. 4. Personality disorders. Borderline personality disorder, BPD. Tense emotions, fear of abandonment, unstable relationships. Narcissistic personality disorder, NPD. Need for admiration, fragile self-esteem, lack of empathy. Antisocial personality disorder, manipulation, impulsivity, disregard for others. Avoidant personality disorder, extreme sensitivity to rejection and social avoidance. 5. Obsessive and compulsive disorders. OCD, obsessive-compulsive disorder, intrusive thoughts and repetitive compulsions. Body dysmorphic disorder, obsessive focus on perceived physical flaws. Hoarding disorder, difficulty throwing away possessions. 6. Neurodevelopmental disorders. ADHD, inattention, impulsivity, difficulty focusing or organizing. Autism spectrum disorder, ASD, differences in communication, sensory processing, and social interaction. Learning disorders, difficulties with reading, writing, or math processing. 7. Eating disorders. Anorexia nervosa, fear of weight gain and extreme food restriction. Bulimia nervosa, binge eating followed by compensatory behaviors. Binge eating disorder, repeated episodes of uncontrolled overeating. 8. Psychotic disorders. Schizophrenia, hallucinations, delusions, disorganized thinking. Delusional disorder, strong false beliefs disconnected from reality. 9. Dissociative disorders, disconnection between identity states and memory. Depersonalization disorder, feeling detached from oneself or reality. 10. Sleep disorders. Insomnia, difficulty sleeping and chronic fatigue. Narcolepsy, sudden uncontrollable sleep episodes. Microphone ending. Mental disorders are not personality flaws, and they don't define a person. They are complex psychological conditions, shaped by biology, environment, trauma, and life experiences, and understanding them is the first step toward empathy.